I'm John McCullough from PositiveLight.com, and I've come today to ACT, the AIDS Committee of Toronto, to meet with Winston Husbands, who is the agency's research director, to talk about a study that Winston and his colleagues have recently completed, looking at the HIV-related needs of heterosexual African, Caribbean, and Black men here in Toronto. And I thought I'd like to start, Winston, by asking if you could just say, what are some of the kind of overriding things that one comes to mind when you think of straight Black guys in HIV here in Canada?
Well, one of the immediate things that comes to mind is that they tend to be somewhat absent from the work that we do, from the work that goes on, both in terms of, just being a part of the movement, in an activist role, in a paid role, tend to be a bit absent. And I think many of us have known that for quite a long time. That is probably the thing that immediately comes to mind. There are other things that come to mind, of course, that many of us have been concerned about how the issue of criminalization of non-disclosure has sort of emerged in the media. If we're not careful, the way how it has emerged would create an impression that somehow this is something that is peculiar to Black men, or that Black men are out of control. So those are some of the, even before we started doing this study, those were some of the things that we were thinking about. Of course, that is part of our everyday experience of doing this work.
Right. So how, Winston, did you actually go about researching this issue?
Well, so there were several of us involved. There was a team. We are from different organizations, but most of us are affiliated with ASHO, the African and Caribbean Council on HIV and AIDS in Ontario. So it was a collaborative venture. And in some of our actual meetings and so on, my colleague Fanta Wanguiba from the Executive Director of Africans in Partnership Against AIDS, this is an issue that I had heard her raise several times. So eventually some of us decided, well, let's do a research study to find out what this is all about, and to get to the bottom of some of these issues, and provide, and that would sort of guide us in the way how we might think moving forward. So we came together, I think 6 of us, and we developed this proposal that was eventually funded with a small grant, a catalyst grant from CIHR,
which is the Canadian Institute for Health Research.
Yes, and that is how we started. So we one of the things that we noted from the very beginning, there's a sort of paradox here, in that I think it is well understood among all of our colleagues, among the people who do this work on HIV in Ontario, that African, Caribbean, and Black people tend to be disproportionately burdened with HIV, if I might put it that way. So the best estimates suggest that while Black people make up maybe 4 or 5% of Ontario's population, we account for maybe 18 to 20% of the total number of people living with HIV in Ontario. So that's a you can see what we mean by disproportionate, why we use that term, disproportionate. However, I think one of the things that many people don't realize is that within that group of people, and these are all people who have been infected through heterosexual contact. So they're also Black men, gay men, and other men who have sex with men, who in these epidemiological data are counted in a different category. So the category that I'm referring to is people who are infected through heterosexual contact. So among that complement of ACB, African, Caribbean, and Black people, maybe 58 to 60% are men. So we wonder then if this is the case, if by all estimates there are more men, black men, living with HIV than women, then why do black men seem so scarce in our work? Where are the services? Where are the efforts to do the outreach? Where are the efforts to do the education and so on for heterosexual black men? So that's the paradox that we came with. We also came, of course, with based on how we normally understand masculinity and the way how black men are sort of heterosexual men are constructed, or how heterosexuality among black men is understood, that because there has been a sort of what I call a rhetoric of blame in black communities, that it's these men who are quote unquote heterosexual but may also be having sex with men on the side, or quote unquote men who are being unfaithful to their wives and their women partners, have been responsible for bringing HIV into our communities. So there's that idea of blame. And, within that sort of way of, when people try to understand HIV in black communities, in African Caribbean and black communities in that way, it isn't an environment that black men would consider to be welcoming. So maybe people feel, well, that's not, I'm probably not welcome there. And then, beyond that, there's we can also think of how heterosexual black men, or more generally black men, tend to be interpreted more widely as irresponsible, perhaps wanton. Their behaviors are destructive and so on. And within this sort of way of thinking about black men, then it's and you add on top of that then the idea of blame when you look for someone to blame for HIV in our communities. So there are these layers of pathologies, so to speak, that have been attached to black men. So we wanted to get through all that. I mean, we know from our everyday experience that a lot of this stuff really is impressionistic. It can't really be true, but it circulates. So we wanted to get beyond that. What are black men thinking about health and HIV?
Right. So that's a very interesting profile, and a very challenging one. And now you talked to a group of black guys, straight black guys, and as well as some service providers from presumably AIDS service organizations and some researchers.
Yes, we did.
So can you tell us a little bit about what's some of the themes that the guys brought out in your discussions with them?
So we had a focus group in Toronto and one in London with black men, both HIV positive and HIV negative, or never diagnosed, let me put it that way. We also had a focus group with service providers from across Ontario who work with African Caribbean and black communities on issues of HIV prevention. And we also had interviews, one-on-one interviews with 4 researchers in Toronto with a demonstrated interest in health and well-being among black communities. So that's what we did for this study. So a number of things emerged from, we know that black men, or rather one of the main things that, one of the main lessons that we draw from, our focus groups with black men in particular, is that, black men are complex just like everybody else. We know that black men are willing and able to engage their vulnerabilities, though, of course, like other people, they don't always do that in a way that is productive. Sometimes they do it in a way that's unproductive. But we know that black men acknowledge their vulnerabilities and they're willing to engage them. We know that black men, despite the idea that, black men find it difficult to talk about their health and so on, I'm sure that some of that is true. But we also know that black men are willing and sometimes quite able to talk about their health and related issues with their colleagues, their counterparts, their partners, spouses, girlfriends, and children, and so on and so forth. But one of the things that black men told us is that those who were living with HIV, and to a certain extent, those who've never been who were HIV negative or never diagnosed with HIV, is that the landscape of programs and services, health-related programs and services, or HIV-related programs and services, didn't really engage them in any meaningful way. They felt somewhat marginalized, and some of them had actually started. So some of the men who were living with HIV had actually started their own sort of support groups of other men. And among the men who were never diagnosed, there was also talk. They committed themselves, in fact, to carrying on this dialogue that started in the focus group, even after the research had been finished. So those are some of the issues that emerged. There are other things that came out as well. The idea, for example, that, and this is not the first time we've heard this particular thing, that the most recent immigrants. So the way how we talk about HIV, as a global phenomenon, is that we always talk about it being somewhere else. Mm. So new immigrants from sub-Saharan Africa and the Caribbean, they don't come to Canada with an understanding that HIV is also an issue here. So
it's not talked about.
It's not. Much. Yeah, I mean, you don't see. Back in their countries of origin, HIV is a big issue. So it's everywhere. Mm-hmm. Billboards and TV, people saying, how to regulate your sexual behaviors and all that sort of thing. But when people come here, there's none of this. Not in a public way anyway. Mm-hmm. So they don't see this, and they assume that, all of that stuff that you learned about behavior and sexual behavior and this and that, that applied back home, but it doesn't apply here. Mm-hmm. And so that is also another thing that we understand, that people come to Canada when they're first here, and they don't have a sense that HIV is something that is talked about here, or that is it's an issue. It's an issue here.
Or perhaps if it's talked about, it relates to gay men as opposed to
gay men, yes.
Black straight guys.
Exactly. Right? Yeah. So maybe if you went through a gay neighborhood in a major city, maybe you'll see some billboards or posters or something. But elsewhere in the city, you wouldn't see this kind of stuff. And so then it's for a particular demographic. And to the extent that people may exempt themselves from, what we consider to be gay relationships, then it wouldn't apply to them, of course, or it would apply to only a minority, but not the majority. And so that's something that we definitely have to think about.
So when you talked with service providers, did they raise some of the same issues, or were they
service providers raise some of the same issues? The idea, for example, that agencies have to do more. There's more that agencies can and should do to really understand the needs and the priorities and the challenges of heterosexual black men, and to be able to address those. That the idea, for example, that there's a role but I think that the service providers also understood that black men were probably interested in the work that is going on with community responses to HIV around Ontario, but we must also remember that, as is the case with many other kinds of people, that HIV for many people becomes a theoretical possibility, but there are other things that become more urgent, like finding a job, all these kinds of things, and so people may be aware of HIV. They know, okay, this is something that could happen to me, but right now my priorities are getting a job, getting an income, etc., etc. I'll think about that maybe this evening or next week or next month. I'll think about HIV. So, but one of the other interesting things that came up in the focus group with service providers is about the whole idea of heterosexuality. That people don't, service providers, at least the ones we spoke to, the idea that when somebody comes into your agency, they could be heterosexual or not. In other words, because of the course of the epidemic in Canada, we all do this. We all make certain assumptions about the people whom we encounter in doing this work. So, your first blush wouldn't be to think, oh, well, this might be a heterosexual man. It might be something else. Or there's also a different way of trying to understand that, in that you might assume, okay, so this is a heterosexual man. He probably has some resources at his disposal that he could look after himself anyway. Or, well, this is a heterosexual man. He probably is not going to open up to us about what his issues are. So there are some assumptions that might, interfere with people's ability to really reach out and do what they think should be done. So sometimes we have to set aside our assumptions about who people are. Yeah.
And that's kind of a nice segue into my next question, which is around research, because I know there's not a lot of research being done around the HIV-related needs of straight guys, and in particular straight black guys, right?
No, there has not been. And so the way how we frame it is that, the response to HIV hasn't, in this particular regard, hasn't kept track with changes in the epidemiology since the early 1980s. So there are some, fairly major changes in the epidemiology of HIV since the early 1980s, but the response hasn't necessarily kept up with that. I think that there's also another reason, which is not only about heterosexual black men, it's about heterosexual men in general, that we assume that heterosexuality comes with certain privileges, and to a certain extent in this society and in others that may be true. But we also have to acknowledge that those privileges do not accrue to all groups of men in the same way or to the same extent. So you would say, well, heterosexual men don't really need services because everything that's here really has been set up by them or in their image, or they have means, they have resources, etc., etc. This might be true for some men, but it is by no means true for all groups of men.
Right.
Yeah.
Right.
So I think that so there has been that tendency to think, well, heterosexual men don't really need services, and of course, and that's related to another long-standing problem in that HIV did not evolve as an issue that burdened heterosexual men. That's not how HIV emerged and how it evolved over the years. But now we know, of course, that an increasing number of people who are becoming infected are heterosexual men.
Right. So those are enormous challenges and issues that you've identified in your research studies. So where do we go from here? What were some of the outcomes or next steps that you thought we should be taking to address these issues?
Well, there are a few. Perhaps one of the most straightforward, the idea, and this is not only true for new immigrants from what are called HIV endemic regions or HIV endemic countries, but it's perhaps true for all new immigrants, that there needs to be, that we can produce a resource or a set of resources that people can become familiar with as part of the immigration and settlement process. This is for new immigrants to say, well, HIV is an issue here. This is how, this is why. And if you need access to services, or if you need to talk to someone about HIV, here's where you can find help.
Right.
That big. And something like that, I mean, is not only, of course, for us, it would have a special significance, but it could be more general than HIV. It could be about all kinds of health-related issues. This is how this particular thing is an issue in Canada. And, here's what you need to know. And here's what you can get help or advice if you need it. Yeah,
right.
Very simple thing. There are other things that we can draw from other kinds of programs or that we can draw from this. And they need not involve a huge expenditure of new money or anything like that. But the idea, for example, that agencies can sort of develop ways of engaging and recruiting heterosexual men into their work, not necessarily, throughout all the sort of levels of their work, whether it's staff or volunteers or whatever it is that people want to engage, but that there is some process whereby heterosexual men can feel, yes, I deserve to be here. I am welcome being here. And that, and these processes would also be pathways to leadership because, as we know, some people might just want to volunteer once in a while. The AIDS Walk, for example. I come and volunteer once a year, the AIDS Walk or whatever. But some people might want to do more, get involved at a higher level. And that there are these pathways to different levels of involvement are there. Another thing is that, so for Black communities, for African, Caribbean, and Black communities in particular, I think that the strategy workers throughout Ontario, those people who part of whose job in an AIDS service organization is to work on issues of HIV prevention with African and Caribbean and Black communities, that they can also recruit some of the heterosexual men from their communities to advise on how they might design or roll out various kinds of parts of their work to get the interests of men, to capture the interests of men. So these are some of... and another thing, of course, is in the way how we... HIV always has a face. There's always a face that we put out there, depending on the message that we want to put out there, or who we want to, or who we think this message is for. And there must be a way of including a greater mix of profiles or faces that captures the sort of the breadth, really, of the people that may be affected by HIV, the breadth of the people that we're serving, make people feel a sense of ownership, a sense of involvement, and and a sense of acknowledging that HIV is something that we have to think about. Not necessarily that we have to spend every waking moment thinking about it, but it is something that is on our horizon.
Right.
Yeah.
So, Winston, you have in your hand your report, Talking Black,
yes,
which really summarizes all of the themes that we've been talking about today. And this report is available on the ACT website, and you'll see, we'll bring on the screen now the address that you can access and download this report. So, Winston, those are enormous challenges. I really commend you for the work you've done to address the needs of heterosexual African, Caribbean and Black men here in Ontario as they're impacted by HIV. So we look forward to the results arising from this report. Thank you for talking with me.
Thank you, John.